Hello. So today for my case study, I'm going to be showing how to do two modalities. I'm going to practice person-centered and Gestalt therapy. So for today's case study, we have Sky. Sky is a 38-year-old man. He is sent to your inpatient drug rehabilitation facility on court order. He was recently arrested for drug possession. He must complete your facility's programming successfully within 90 days as evaluated by his care team in order to be considered for a lesser sentence, less jail time. So he's currently kind of been in and out of the court system his whole life, just with like drug possession, and he's currently going through it again. So, despite this, Sky is incredibly compliant with the rules of your facility, yet he is quiet and closed off to most of the staff. In his biopsychosocial assessment completed by your supervisor, he expressed a genuine desire to become sober and get better for his daughter. You also see notes that he has very low self-esteem and feels very anxious about his likely jail time in 3 months. So, for the first little clip we're going to do, we're going to practice person-centered therapy. I'm going to practice unconditional positive regard for Sky, reflect on resilience and strengths, and then just kind of aim to empower him. This is a real client that I worked with in real life. I was obviously not his therapist, but this is just kind of the direction I would have gone in if I had the opportunity to be his therapist. So, okay, to begin. Well, welcome, Sky. It's really nice to meet you. This is our first meeting. Why don't you tell me a little bit about, you and just kind of like what brought you in to our facility?
Well, I really don't have a choice. The judge said I had to come talk to you, but I got busted for drugs, and so yeah, I have to talk to you.
Yeah, I guess you do. Um, wow. How do you how do you feel about being here? Tell me a little bit more
Well,
about that.
I want help. I've always, I've been in trouble with the law a lot, and I've been in and out of jail. Just feels like I can't quite get my life together, and I want to for my daughter. I want to spend more time with her and be a part of her life, but I keep landing myself in prison because I am addicted to drugs and feel kind of
Hmm.
stuck.
Wow. Sounds like you've experienced a lot of, the unfortunate, difficult sides of addiction in your life.
And I definitely have. I don't want to be this person and be in this spot anymore, but
Wow. Tell me tell me a little bit about who this person is. Tell me a little bit about Sky.
well, I grew up wanting a different life. I thought I was gonna, be in business and had a desire to go to college someday, but somehow started hanging out with these friends in junior high, and you know, got they were smoking marijuana. I thought it looked fun, so I just decided to join, and I ended up using harder drugs and just can't quite get away from them. It just has kind of pulled me into this life that I did never want for myself.
Yeah. Addiction it's a little sneaky disease. We don't ever anticipate it, you know, coming on or doing different things in our lives, but and then there it is one day and it's just really difficult, you know? I mean, I'm sure you know.
It has been difficult.
I'm really sorry to hear that, Sky. Sounds that sounds really tough. I I feel like I've been hearing, a lot of um the difficult things I've gone through, and I don't want to discount those, but and it sounds like, you've been very resilient to even make it this far. But I want to hear a little bit about maybe some positive things that you believe about yourself. Tell me about those.
Well, I feel like I'm a hard worker and that I'm really determined when I'm not, so lost in my addiction. But sometimes, when I am relapse, then I kind of lose myself on that determination and hard work and I thought I was a good guy, but I keep ending up back in jail. So I don't know. But I really do want to get sober and get better and be the
Yeah.
person that I thought I could be someday.
I keep hearing you saying, that you're really hardworking and you want to be this person that you feel like you worked hard for. I think that's really great. I think that is a really great trait to have as, someone who's struggling with addiction. Um, I also noticed that you talked a little bit about relapse, and I wanted to ask you a question. Do you think that relapse is a part of addiction recovery?
I guess so. But I keep going back to it. So I don't know if I'm really on the right path to becoming, to getting better.
Yeah. Um, okay, I want to move into Gestalt therapy because I feel like this is kind of the perfect moment for me to start some confrontation with Sky. So I'm going to move into my second modality. So, okay, so I hear you saying that maybe it is, right? Maybe relapse is a part of it, but you keep falling back. Could these relapses be a part of your journey forward?
Guess if I kind of think about what I've learned from each of them, maybe that could help me in the future so that I don't keep making the same mistakes. So right now I just feel like I keep making the same mistake over and over and getting busted for it.
Mm. So, so what I'm hearing is these could be potential like learning opportunities, right? They're part of the path forward. And I think um just a little bit of, psychoeducation here. When people are going through addiction recovery, right, and on this path to make their life better, relapse is a huge part of that. And recognizing when you relapse, like, okay, like what can I learn from this? Not only that, but that it doesn't have to diminish everything that you've worked for and everything that you want to be, right? Is that something is that something you believe in?
I want to believe in that. That sounds way better than what I've been thinking about myself, that I'm just a loser and I'm never gonna be able to stay out of jail and see my daughter and be a good dad to her.
Yeah. So, talking about your daughter, is she a really one of your motivating factors um for your addiction recovery?
Yeah, for sure. I want to be there for her. My dad wasn't there for me, and I never had a good relationship with him and really wanted to do better by her. So to be the dad I never had, and somehow I just can't quite get myself there.
Hmm. What's stopping you from getting there?
Well, definitely the drugs, because, sometimes that's the only time I feel really good about myself is when I'm high. And so
Hmm.
I feel like I keep going back to that because I do feel good when I'm high.
Hmm. So you feel so what I'm hearing you say is the only time you're feeling good is when you're high. But I also am hearing at the same time that you have a lot of love for your daughter. Um, I'm kind of curious. When you're high, is that the only time that you feel love for your daughter?
No, I don't even usually think about my daughter, I guess, when I'm high. And I don't like the way I feel when I come off the high. That's
Hmm.
not a good place for me. So it just makes me want to get the next high.
So, are there then moments where you're able to give love to your daughter or, be a dad when you're not high? Have there been moments in your life when that's occurred?
There's been a few. Like her mom, my ex doesn't really trust me, so I don't get to really be around her very much. But there's been a couple times. One time I went to the park with her and it was so much fun. She just was really happy that I was there with her and it made me feel really good. And I remember that all the time, like when I'm in jail, wishing that I could have another experience like that with her.
Um, I think just kind of listening to that, it sounds like there that she is a really like a good motivator, and she's also, you know, a reasons to have, joyful, happy feelings outside of being high. Am I kind of correct when I say that?
Yeah, when you put it that way, yeah, it's true.
So, well, that's good to know. Um, I kind of wanted to run through maybe a little bit of an exercise with you. Let's say, okay, what's your daughter's name?
Her name's Charlotte.
Charlotte. Let's say that we brought Charlotte in with us, like right now, and she was sitting in the empty chair over there. And you had an opportunity to just tell her anything, how much she means to you, what advice you would give her. What would you say to Charlotte right now as someone, as a dad in addiction recovery, trying to make his life better for her? What would you tell her?
Well, I would tell her to make sure and choose really good friends because the people you choose to hang around with are definitely
Okay,
going
wait, I'm
to.
gonna pause you right there.
Okay.
So I don't want you to say, sorry, I was not very clear. I didn't explain this exercise very well. Instead of saying, I should tell her this or I want to tell her this, I want you to speak to her as if she's right there.
Okay. Yeah, I can do that.
Okay, go for it.
So, Charlotte, I just really want to tell you how important it is to choose good friends because the people that you choose to be your friends are going to make a really big difference in what happens in your life. And I didn't choose good friends when I was about 13 years old, and it's made my life really hard. And I know my choices and those hard things affect you, and I'm really sorry. I'm really sorry that I can't always be with you and that, you know, when it was your birthday, I was in jail and that was really hard for me. And I just want better for you. I want you to not make the same mistakes I did and have the same hard life. So I want you to know how much I love you and that when I make those choices, it has nothing to do with how I feel about you or the love that I have for you. And I'm going to do better. I'm going to change this part of me so that we can have a good life together.
That was really beautiful. How did you feel? How did you feel saying that to Charlotte?
It actually made me feel really good and it made me think maybe I can do this. It's been feeling stuck, but maybe this really is the time that I can change.
Yeah. How how would you do you feel like if we were to, let's say, like down the road in therapy, in your time here, right? You're here for 90 days. We were able to find a way for Charlotte to come visit. Do you feel like that's something you could maybe work up to talking to her about? Do you feel like that would be beneficial?
Well, it's hard for me to want her to see me in jail and locked up, but I would love to see her and I would love to have an experience like I just had just thinking about it. So I think it'd be a good thing to work towards.
Yeah. Maybe that's something, in future sessions we can work towards that and I can talk to our team about maybe setting that up in the future. Um, well, there is one more thing I wanted to just kind of leave you off with today, uh, just as our first session. I wanted to do something called like an exaggeration exercise.
Okay.
So just throughout today, I've kind of seen you Like when you're talking, I notice you kind of like are turning in a little bit. Even when you were talking to Charlotte, I noticed this just kind of like turning into your body a little bit. Did you notice that?
Yeah, it's hard for me with making so many mistakes. I just don't feel like I'm, really a good person, and it's hard to not turn in.
Hmm. So I wonder if maybe if we could kind of, so what we're gonna do is I'm gonna have you do like an exaggeration of that movement, kind of just this like really close in. So we're gonna do it together, okay? And I
Okay.
want you to notice just kind of how you feel when you do that,
Okay.
okay? So just kind of really in on yourself. You just sit there for a moment. What what's kind of coming up for you in that position?
Um, I guess I feel a little more safe just kind of curling into myself.
Yeah, kind of hurling into yourself. Tell me a little bit more about what that means.
Well, I don't, it's embarrassing what I've done in my life, and just kind of being closed off makes it less embarrassing because then I'm like, don't want people to see me and don't want people to know what I've done. And I'm really feeling anxious about I have to go back to jail probably in 3 months. So
Mm.
just don't feel very safe right now. And kind of curling into myself makes me feel safe. And
Hmm. So what I'm hearing is, when you kind of bring yourself in, you feel unsafe, you feel maybe a little bit ashamed, anxious, and this is just kind of a self-soothing exercise, right?
yeah, I guess that's a good way to say it.
So now what we're going to do is we're going to go in and do the opposite and do a power pose, okay? And we're going to hold that for a second, coming from here, here, okay? And then I want you to, while we're in this kind of power pose, I want you to think about maybe some of the positive things we've identified to date, right? Like your motivation, you're a hard worker, you're a great dad from what it sounds like to me, and you want to be a great dad, right? So let's try that. Okay, ready?
Okay.
Start closed and into the power pose. All right. How did that feel for you, Sky?
I felt stronger. I felt more confident and not not as embarrassed. Like I could do this. I could use the lessons that I've learned from these mistakes I've made to try to become better and get out of these negative loops that I've keep getting caught in. So I like that.
Yeah. I'm really glad to hear that, Sky. And I genuinely do believe in you. And hearing your story today has been, really touching for me to just kind of hear your motivations and about your daughter, and that conversation that you had with Charlotte was so sweet and so meaningful. I think as we continue to meet, I'm really excited to work with you. I think you can tell me if you have other ideas, but I think that we've been able to identify some really good motivators and some positive traits that you hold in yourself. You're also welcome to do that chair exercise or kind of that power pose exercise um, during your stay here if you're ever feeling down on yourself. What can you tell me a little bit about how you think the session went and how you feel about moving forward?
Yeah, I think you brought up a lot of really good things, and it's helpful to know that, relapses are part of the experience towards changing and getting out of the addiction cycle. I feel like reminding myself that this is worth it for my daughter and that I want to be there for her and I want to be a part of her life and be a good example. I think those are going to help me get through this rough time of going back to jail again and trying to keep that focus instead of kind of going back in within myself and shutting down.
Yeah. Yeah, that's really good to hear. And I have noticed, that you talked a lot about a lot of anxiety going back to jail, and um that's definitely something I want to talk about in future sessions. I'm not ignoring that for sure. But it's been really great meeting with you today. It's good to hear feedback, and I'm excited to see you next week.
Yeah, thank you so much. I'll see you next week.
Okay, so just to kind of talk about why I chose the modalities that I chose person-centered therapy because Sky, he's been noted to be really closed off. He's noted to have low self-esteem. I thought person-centered therapy would just be a great way to kind of help him feel better about himself, show that I care about him as a therapist, and help him reflect on his strengths and feel empowered. And then I chose just salt therapy just because, again, I think allowing him to just kind of confront those really intense emotions that he's going through. And also knowing this client in real life, again, I really think he would have benefited from assault therapy. It's a really good way to help release a lot of built up guilt and help stand up for himself. Especially, being able to be more honest with his daughter. So that's why I chose those two modalities.